Hey, Dr. Birchler from the Chiropractic Health Center. Sometimes people wonder if disc herniations are painful. Maybe they've seen things on internet or read imaging reports, things like that. You hear things about people having MRIs, and 30 or 40% of people have disc bulges on MRI and no pain. So it's a fair question, but there's certainly some things that are absolute in this and are very common. So let's look at an example here of a disc. This is a disc, and what this model shows is the red stuff would be what's called the nucleus pulposus, which is like the jelly or gel center of a disc. Then you have this tough fibrous cartilage area of the disc. Now, one of the factors that comes into play is if you imagine, if you just look at this fibrous part of the disc, there in an adult, there's only pain sensitivity or nerve endings that sense pain in the outer one third of that. So you can have stuff happen like this shows here, where the jelly starts to tear the internal layers of the disc. These discs have these concentric kind of rings, so it can tear through the inner portion of the disc. It is an injury; it's tissue damage. The disc is having a problem, but there's no pain sensitivity until that herniation would get out to about there. There's the anatomy. There's not pain sensitive nerve endings until it gets to the outer rings there. So by the time somebody has pain in their disc, they've typically already had a internal disc injury, wear and tear progressing for commonly for years or decades of time. And it's kind of like the straw that breaks the camel's back. And once it kind of tears through the outer layer and it's getting close to the edge, then you start to get pain. Now, that being said, let's look at this model, because this is different. So this shows what would be a true herniation, kind of a classic disc herniation. And what you're seeing here is the jelly is like blown out of the donut, so to speak. It's actually certainly gone through the outer rings, and it's actually sticking out beyond the disc. This material, this nucleus pulposus, when the body develops, it is the immune system is never exposed to that material that develops inside the disc. There's no blood supply there. The body never sees it immunologically. So once one drop of that ever gets out of the disc and into the fluid, outside of that ring of that disc, it becomes exquisitely painful at the beginning. The body senses that there will be an immune reaction. It's like it's like a blowtorch. There's exquisite pain with that. So yes, it will be painful when somebody has a new disc herniation. Now, the body being the amazingly incredible living organism that it is, will sense that. And now that it's exposed to the immune system, the immune cells will actually come in and start to break down or dissolve that disc material. And that the acute phase of that commonly is going to be a few months of time. So somebody could be in really, really bad pain for several weeks or a few months, and they may be in horrendous pain, which is why some people, you're like, man, I can't deal with this, and they end up in surgery. Short answer is yes, a new disc herniation will be painful. Now, after that inflammatory process of the body goes through there, and the immune system starts to kind of work on that, the severe pain may subside, and it may turn more to stiffness, more positional pain, things like that, lower level aching, numbness, tingling, but not be as exquisitely painful. So it definitely can change, but at the beginning, once the body first is exposed to that, it is going to be very, very painful. So in that early stage, when somebody's having that severe pain, you can only deal with that for so long. And so sometimes people feel like they can't hang in there very long. So if we can actually physically get that disc to pull away towards the center and away from the nerves that come out of the spine, that mechanically can help a person get through while the underlying process is healing or repairing. And the other thing that will happen is when we use what's called spinal disc decompression, and you're able to get the spine to have this elongation, it pumps the disc. And that pump of getting fluid into the disc tissue actually speeds the rate that the immune cells are coming into contact, or fluid is getting in there, and it's like it speeds the rate of that resorption of the body of the disc. And in my experience, clinically, that can help people get through that phase faster, where they can get through it non-surgically. Problem with doing these things, going in there, cutting them out surgically, is the disc will wear out or become degenerative fast. There's obviously risk, of complications. Maybe between 10 to 40% of people have what's called failed back surgery syndrome, where the pain comes back. Oftentimes, it's chronic and hard to go away. Many people wish they never had surgeries. And then you have a small but real risk of dying from a surgery. Roughly 1 out of 1,200 people, even from what's called a microdiscectomy, will die from risks of just inherent risk, blood issues, anesthesia, all these kind of things there. So that's an elaborate or long-winded answer, but yes, people, herniated discs are painful, though the body will put mechanisms into play that over time that pain can subside, and the body of its own accord will start to repair on that. And then we can use mechanical interventions from the outside to speed up that process and help a person get through this kind of scenario the huge majority of the time without having surgery. Hope this helps.